Well, you've heard this one before. The eyes tell all, right? Well, especially when it comes to your age. Dr. Patti Flint is a board-certified plastic surgeon, and she says she can help you look younger by improving the look of your eyes. And it is so true, Dr. Flint, because, you know, as we get older, it seems like that's the first place our age ends up showing up.
For most patients, it is.
Yes. Now, tell me the type of procedure that you do, and you say it's a little downtime?
It depends exactly on how we design the procedure, but many patients complain of extra skin in their upper lids, making them look tired. Or in the lower lids, sometimes bags can occur, and surgery is really the best way to treat those particular problems.
Now, we're taking a look at one of your patients right here, clearly a young woman, and sometimes I'm thinking that this could even be genetically related.
Absolutely.
Right?
She's in her mid-40s, and her father had heavy upper lids, her mother had bags in her lower lids, and she was just tired of being judged older than she really was. So we took the upper skin away, we tightened the lower lids, and she really does look 10 years younger and is exceedingly happy with her result.
Oh, I bet she is. She sure does. And even on this particular picture here, you can see just from the side view how it does makes her look tired and just kind of just, you know, way older than she really is.
Absolutely. She looks more awake, more alert, and younger.
Yes, and younger. There we go. Now, it's the thing about this type of surgery, though, that I think it's important for people to know. If you pick, when you fix the upper eyelids, there's just so much you can do when it comes to around the eyes. For example, with this type of surgery, you can't fix wrinkles.
Well, I think one of the beautiful things about practicing in this era is we can integrate topical skincare, injectable Botox, and surgery to provide the most natural appearing and most complete results that are long lasting.
Ah, okay, so then it becomes a combination of things.
Exactly right.
So when you look at, for example, this one right here, wow. I mean, we're talking a good 20 years right there. Did you do more than the eyelid surgery here?
She actually did also have a face and neck lift, but I think really the thing that makes her look more youthful to the greatest extent is the work that we did around the eyes in her upper and lower lids. She was an ex-smoker, had smoked for 30 years, so certainly the topical skincare and some of the injectable treatments helped, but I think the eyelid surgery really is the telltale sign that she's really made some improvements.
Yeah, absolutely. Well, let's talk about the downtime. How long, if it's just the eyelid surgery, how long can someone expect to be out of work or out of commission?
Well, for upper eyelids, it's a quick recovery. Usually within 10 days, you're certainly restaurant ready. Lower eyelids is a little bit of the opposite of that. In our drier climates, the recoveries are a little longer, so you plan on about 4 to 6 weeks before you're really able to use the computer for extensive periods of time or have photographs taken or something like that.
I see, I see. And you know, one thing that you said earlier, because sometimes there are other procedures that might be necessary, how do you determine when someone comes in? Because they might be watching this segment right now and going, oh my gosh, I have those heavy eyelids, but there might be other things going on. You have to take it one patient at a time.
Absolutely. I think a consultation with an experienced board-certified plastic surgeon is really in your best interest, and we can talk about whether we're going to jump in all at once with multiple modalities or we're going to take it one step at a time, and it's really up to the patient's desire, and any qualified board-certified plastic surgeon can help you develop that plan that's best for your needs.
Right, and once they sit down and talk with you, they might find, well, the eyelid surgery might be an option now, or maybe trying an injectable first to see how that works. You can take it in baby steps.
Oh, absolutely, and many patients do that. So it's really about spending time with the plastic surgeon, getting your questions answered, and going to someone that's willing to listen to the way you want to approach your rejuvenation.
All right, well, there you go. And guess what? Dr. Flint also has a special offer for you. You mentioned Sonoran Living Live when you schedule or book your consultation. She's going to give you $100 credit towards a surgery should you choose to go that way. Patti Flint is located in 2 different locations across the valley, one in Old Town Scottsdale, one in Mesa, 480-945-3300. You can also learn more about her at pattiflintmd.com. Thanks, Dr.